Bismillahirrahmanirrahim. Respected panelists, dear colleagues, Assalamu alaikum. I am Dr. Charagh Hussain. I will be going to talk about heart diseases in Pakistan and South Asia. काफ़ी कुछ तो डिस्कस हो चुका है, लेकिन लकीली उस वक़्त कोई था नहीं हाल में, इसीलिए मैं शायद कुछ बता सकूं और आप लोग उसको ले सके. I will be discussing this topic under these headings. Asia, which is the largest continent of the world by both area and population. But I will be discussing cardiovascular diseases in South Asia only. That include Pakistan, Bangladesh, Sri Lanka, Nepal, and India. Cardiovascular disease is always a major health concern in Pakistan and South Asia, contributing significantly to mortality and morbidity. There is cardiovascular diseases on rising trend in Pakistan, located at the crossroad of Central Asia, Middle East, and South Asia. Pakistan is the fifth most populous country of the world. Populous, not popular. And over the last 30 years, we have economic and industrial growth, but regional conflict, natural disasters, and limited investment of government in health have stunted progress in health indicator. Compared to our neighbor in the east, we have the lowest average lifespan, that is 67 years for men and 69 years for women. Regarding burden of disease, this has already been told in the previous presentation. Cardiovascular diseases is responsible for 31% of all global deaths. 17.9 million deaths were reported in 2016 due to cardiovascular diseases in the world. Out of these, 85% were due to cardiovascular diseases in the form of heart attack and strokes. South Asia, which make 25% of the world population, but contributing 50% of the global death. And more than 3/4 of these deaths occur in the low and middle income countries, particularly in South Asia. Early onset and severe form of cardiovascular diseases, particularly coronary artery disease, is responsible for the higher mortality and morbidity in these regions. According to the 2019 Global Burden of Disease studies, Pakistan is not only have increased incidence of cardiovascular diseases, but also increased mortality from cardiovascular diseases as compared to the rest of the world. अगर आप फिगर को देखें तो पाकिस्तान में 918 per lakh cardiovascular disease की incidence है as compared to the 684 per lakh in the other ethnic groups. Same for the deaths, cardiovascular deaths, 357 per lakh in Pakistan and 239 per lakh in the rest of the world. In the National Socio-Economic Registry survey, cardiovascular diseases were self-reported by 18.9% participant in Pakistan. Regarding risk factor, as I have mentioned, most of the risk factors have discussed extensively in the previous presentation, but these are traditional risk factors: hypertension, high cholesterol, insulin-resistant, abdominal obesities, family history of heart diseases. Hypertension, in one study was reported in Pakistan, 37% of adults are hypertensive and 30.8% are diabetic in Pakistan. Emerging risk factor, we have whole presentation on this emerging risk factor by Dr. Nasir Saab. but I will be just stressing what will be the impact of these emerging risk factor, a novel risk factor on the risk of cardiovascular diseases. And remembering her risk score, अगर किसी की आता है मॉडरेट रिस्क फैक्टर, अगर उसमें नॉवल रिस्क फैक्टर है, तो दैट विल बी अपग्रेडेड टू द हायर रिस्क फैक्टर. अगर किसी की लोअर है और उसमें प्रेजेंट है तो मॉडरेट पे, एंड वाइस वर्सा. और उसमें इम्पोर्टेंट एलिवेटेड लेवल ऑफ लाइपोप्रोटीन एंड एडिपोकिन लेवल हैं जो साउथ एशियन पीपल में ज़्यादा हैं, और ये बोथ प्रो इन्फ्लामेटरी भी है और प्रो थ्रोम्बोटिक भी है, दैट प्ले एन इम्पॉर्टेंट रोल इन इंक्रीजिंग द incidence of coronary artery diseases. And other have been already discussed: psychological stress, air pollution exposure, and genetic risk. पाकिस्तान में एक स्टडी हुई थी रिकॉर्डिंग द जेनेटिक रिस्क, द अर्ली अनसेट ऑफ द कोरोनरी आर्टरी डिजीज, और उसमें 58% इंटर फैमिली मैरिजेस रिपोर्ट हुई थी, फर्स्ट कजन, सेकंड कजन मैरिज, एंड प्रोबेबली दैट may be responsible for the genetic clustering of the disease in this area. तो challenges क्या हैं? Pakistan is spending only 1.2% of its GDP on health, which is lowest in the world. पूरे पाकिस्तान में we have 150 functional cardiac catheterization lab, and only 35 of these cardiac catheterization lab offering round the clock, round the week primary PCI services, which is again very low. अगर हम डॉक्टर टू पॉपुलेशन रेशो देखें तो 1.09 डॉक्टर फॉर 1,000 पीपल, and we have total currently 1,550 cardiologists who have awarded fellowship degree in cardiologist through the College of Physician and Surgeon Pakistan. Few cardiologists have returned back from US and UK after completing their training and their serving our country. More than that, the accessibility to healthcare, particularly in rural area, and cost of treatment are other challenges in this area. हमें करना क्या चाहिए? Current data, published data regarding cardiovascular diseases in Pakistan, मेरा टाइम खत्म है. अच्छा, that is scanty and outdated. But recent effort included Cardiac Registry of Pakistan, which should be appreciated, with the name of Crop Registry, which is monitoring the quality of interventional procedure and management of acute coronary syndrome. We need support of government in vital registration, documentation of deaths, cause of death, and community survey. We must expand our healthcare force, work services, and community health workers should be used for reduction in cardiovascular risk factor in the community. Sehat Sahulat card, recently initiated at the provincial and federal level, but that cover only inpatient visits. अभी काजमी साहब बता रहे थे प्रिवेंटिव कार्डियोलॉजी उसमें कवर नहीं है, जो बहुत ज़रूरी है. जो फंटास्टिक 4 प्रोग्राम जो सर ने बताया, अगर उसकी कवरेज हो तो सर इनकरेज भी होगी और काफ़ी हेल्पफुल भी होगा. इन पेशेंट विजिट, आउट पेशेंट विजिट्स, मेडिसिन कवर होनी चाहिए. और एक और बात, टाइम ही नहीं है, लेकिन जब ये प्रोग्राम इनिशिएट हुआ केपी में तो सबसे ज़्यादा क्लेम आए थे कार्डियोवास्कुलर डिजीज़ के. इसका मतलब ये है कि कार्डियोवास्कुलर डिजीज़ इज हायर इन दिस रीजन. ऑलरेडी मैं बता चुका हूँ, करंट डेटा, पब्लिश डेटा स्केंटी भी है, आउटडेटेड भी है. वी मस्ट प्रोमोट लोकल कार्डियोवास्कुलर रिसर्च एंड लीडरशिप. हमें हेल्थ प्रोफेशनल टीम एंड एजुकेटर टीम डेवलप करनी चाहिए जो कि मदद करे टू रेज अवेयरनेस ऑफ हार्ट डिजीजेस, risk and prevention. This team should also offer blood pressure check and nutritional counseling. Community engagement and media management will play an important role in this regard. Thank you very much.